talk about prenatal health and nutrition. Eating a healthy, well-balanced diet and maintaining an exercise program throughout your pregnancy is taking care of yourself and your baby. You want to choose foods like fruits, vegetables, whole grains, and lean proteins for a balanced diet. Use myplate.gov to find the diet that's appropriate for you. Avoid foods that are high in sugar, like soft drinks, sweet teas, and desserts. These things are high in calories but low in nutrients. The Center for Disease Control, or the CDC, recommends that pregnant women avoid foods that are unpasteurized. Things like hot dogs, lunch meat, soft cheeses, and raw shellfish can carry the bacteria Listeria, which can be damaging to your unborn baby. Let's talk about beverages. Everybody knows that drinking water is important, but it's especially important when you're pregnant. But what about things like coffee? Do you guys like coffee?
Oh, yeah.
We want to try to limit our caffeine intake throughout pregnancy. We want to avoid things like alcohol, drinks that are high in sugar, and limit the amount of sugar substitutes that you're taking in throughout your pregnancy as well. Unpasteurized milk and other beverages should also be avoided. It's important to take your prenatal vitamin every day throughout your pregnancy. If you haven't started yet, it's never too late to start. Choosing a prenatal vitamin that has at least 400 micrograms of folic acid is important for your baby's brain and development. Other nutrients that you want to include in your diet are iron, vitamin D, calcium, and omega-3s. If you plan to take other supplements throughout your pregnancy, talk to your healthcare provider first. Along with a healthy diet, maintaining an exercise program throughout your pregnancy is good for your health also. Are you guys exercising?
Yeah.
What kind of exercises are you doing?
Mainly just walking.
Walking?
Yeah.
Prenatal yoga.
Prenatal yoga. So usually maintaining your current exercise program is safe throughout pregnancy. Before beginning any new exercise program, always talk to your healthcare provider and avoid anything too strenuous. Whatever exercises you're doing, make sure you stabilize your lower back and pelvis, and that includes your everyday household chores as well. Most women are familiar with Kegel exercises, but Kegel exercises become even more important throughout your pregnancy. Your Kegel muscle is part of your pelvic floor, and it takes a lot of strain and pressure throughout your pregnancy. So doing Kegel exercises every day is important to maintaining that muscle strength. You want to sit on the edge of a chair with your feet flat. Start tightening those pelvic muscles like the floors of an elevator. Once you've reached the top floor, you want to hold it there and then release that muscle slowly. Choosing a trigger to help you remember to do your Kegel exercises every day can be helpful. For example, maybe you do your Kegel exercises every time you're at a red light, or while you're watching television, you do them when the commercials come on. But having something to help you remember to do your Kegel exercises every day can be very helpful. Sometimes complications can arise during your pregnancy. Your healthcare provider will be checking you for signs and symptoms of complications at all of your prenatal visits. But some of the things that could happen are high blood pressure, sometimes called preeclampsia. That's why it's important that your healthcare provider is checking your blood pressure at every exam. They also are checking for swelling in your hands and feet, which could also indicate a blood pressure concern. Placenta previa is a condition where the placenta attaches to the uterine lining close to or overlying the cervix, which can be a bleeding risk as the cervix starts to dilate. Your healthcare provider will be checking the location of your placenta during your routine ultrasound. Gestational diabetes is a concern in some pregnancies, and it's something that your healthcare provider checks for usually around the 28th week of pregnancy by having you do a glucose tolerance test to make sure that your body is able to handle the increase in blood sugar. Preterm labor can happen for a variety of reasons. If you are before your 37th week of pregnancy and you have 4 or more contractions in 1 hour, you always want to let your healthcare provider know immediately. What questions can I answer for you guys about worries or concerns over pregnancy complications?
Besides the high blood pressure, what are some signs of preeclampsia?
Headaches, sweating, swelling in the hands and feet can all be signs of problems with blood pressure.
So is high blood pressure during pregnancy the same as preeclampsia, or is it something different?
So you can have high blood pressure and not have preeclampsia. Preeclampsia is like a severe form of high blood pressure. If you have high blood pressure, they would try to treat it. Preeclampsia is like, even though they're treating you, your blood pressure is
not going down.
Yeah.
Okay, so
And it usually happens more towards the very end of pregnancy.
okay.
So that's health, nutrition, exercise, and some possible complications that could come up throughout your pregnancy. Next, let's talk about what you can do to prepare for labor and delivery.